Dr.
Good.
Hammami, welcome.
Thank you, Madam Chair. Good afternoon. Mohanad Hammami, Chief Health Strategist. And if I may, I would like to share with you a very short presentation on
Yes,
our updates for COVID-19. I hope you can see my screen.
yes, we can. Thank you.
Wonderful. Okay, so the good news is we are on the decline for all our cases. In fact, we have seen a 30% decrease from last week. Our total new cases for this period, and we're talking about May 16 to the 22nd, is 762. This is the first week or 7-day period where we dropped below 1,000, and that is since February 21st, so which is great news. And the same is applicable to both our new cases as well as our death count. Our testing remains still relatively continuing. We are seeing more tests, but not as much as we saw during the beginning. This is a very beautiful graph. As you can see, this is our 14-day cases, and again that both the linear as well as the cases are dropping, which is exactly where we want them to be. This is when we started back in March of 2020 up till now, and within a year and almost 2-3 months, we have seen the ups and downs. But again, as you can see here, we are going down to probably similar to where we were in July of last year, which is again very good. Our positivity rate is also going in the right direction. In fact, this current period, we are at lower than the state of Michigan. We've been always higher relatively. And as you can see, 2 periods ago, we were at 9.5, then dropped to 7, and now we're at 5.1, while the state is at 5.4. Again, these are the numbers that we would like to see. We were at some point in June and July of last year, we were in the 3 to 4%, and this is exactly where we should be. Nothing has changed in terms of our top 10 communities, although all the total or absolute number of cases are dropping. However, percentage-wise, we are still seeing the usual top 10, Dearborn Heights, and Taylor are high up, Westland at 7%, Redford and Canton at 5%, Hamtramck, Belleville and Livonia at 4%, and Inkster and Lincoln Park at 3%. These are the percentage of cases of Wayne County. Our variant also have seen a slight uptake. So again, the majority are the B117, which is the UK variant. The good news is that if you recall, 2 weeks ago, I reported that we had only 3 of the B1617.2 India variant. We only gained 1 extra case, which is good and encouraging. Again, we expect those variants to increase, but we are seeing also a slower slope in how they decrease. We didn't get any new school-related outbreaks. These are all ongoing cases. That means they happened before this reporting period. And again, as you can see, they are relatively distributed in different communities and mostly between elementary, high school, and middle. So there isn't a common theme here. And we are starting to see, again, where we were mostly seeing students, we are seeing some transmission in staff as well. Our vaccine numbers are, again, going in the right direction. As of May 22nd, we have received about 300 doses, and we have administered 170,000 and 300,000 doses. We have administered 170,000 and redistributed 76,000. So in total, we are probably at 85% of using the vaccine supply that we received between administering and redistribution. We are, however, as I probably reported last meeting, we are seeing a slower and lower volumes of our standard vaccine sites. However, we started working with the schools, and specifically after the authorization of the Pfizer vaccine for 12 and over. So we have held several school clinics and we have done Redford last week. We have done Plymouth Canton Community Schools, where we had about 420 doses administered, with the majority were in students. We did on May 20th Summit Academy at Romulus, where we had 112 doses, and just last Saturday on the 22nd we were at Northville High School, where we had 560 doses administered. So this is great, because these are the numbers that we would like to see. And of course, we are now tapping into the population that is the younger age bracket, which we certainly want to focus on. This is the numbers from the Michigan Department of Health and Human Services. So the bottom line is that we have now more than 500,000 county residents, and this is out Wayne County data. We have more than 500,000 people that received at least one dose, and that is about 58.6%, almost 59% of all those that are eligible in Wayne County. Those that are fully vaccinated, of course, the percentage is less, because there is that 3 to 4 weeks delay. But if we look at the age groups, the highest we have are in our senior population between 65 and 70-year-old that received at least one dose, and that is about 84%, followed by 75 and older, and then followed by 50 to 64. So these numbers are very good and very encouraging. And even if we start looking at the younger, where we have crossed the threshold of 50%. Of course, our focus now is in the population between 16 to 29 years old, and we just started logging the data for the 12 to 15. I did show you these heat maps. Again, we get those from the Michigan Lighthouse. The Michigan Lighthouse does not provide 12 and over yet, so they limit their data to 16 and over. And as you can see, these are anybody 16 and over in Wayne County that received at least one dose. And the green color is that is over 50% or 60%. And as you can see, our county is now starting to be more green than those areas where they're pink shaded. And this is what we would like to see. Of course, there are still pockets where the percentages are below 50%, 30 to 40, and in some very small pockets, we're looking at 20 to 29. Lastly,
I'm
yeah,
sorry, excuse me.
sorry, yes.
I don't see your screen any longer.
Okay. Let me try to reshare.
I do. Oh, I was still seeing it.
Okay.
Oh, you do see it?
I was when you had it up there.
Now it's gone.
Can you see it again?
Okay,
Yes.
now I can see it again.
Okay.
Okay, thank you.
So that's the heat map, and I have one last slide, and I think this is a good data to show and boast about. These are the vaccine coverage as of yesterday in Region 2 South and North, and as you can see, Wayne County is ranking number 3 in terms of anybody that got a dose. We're only third beyond Washington and Oakland County, and we are even at a higher rate than the state of Michigan. And I'll be more than happy to answer any of your questions.
Thank you. I just had one question, and then we will go to Commissioner Dobb. There is reports of heart complications in young teens. Have you or have Wayne County had any of these incidents, or is it anything you have any knowledge of?
No, we haven't. We haven't seen any serious side effects beyond what we expect, and especially in the younger population. I think most of what we are seeing is the nervousness and excitement about getting vaccinated, but in terms of any serious complications, we are not encountering any of those.
Thank you. Commissioner Dobb?
Thank you, Madam Chair. With the lighthouse mapping, that map, can the commissioners get a copy of that?
Absolutely.
Okay, great. And then I do want to thank you for going out to the schools for those vaccinations. Although I'm a little, I mean, looking at the numbers for my community, at least we had 418 for Plymouth Canton Community Schools. which is great, but we have over 6,000 students at the Plymouth Canton Educational Park, which is our high school complex. I'm hoping that most of the students went, on their own time and got vaccinated at the clinics or at a pharmacy or their doctor's office. But, when you look at the number of students that attend, and that's not including charter schools or private schools in my community, that 400 number is a bit small. So I don't know if you had any insight on.
No, absolutely, Commissioner. It is by all means not the only place. So we know that many of our pediatric clinics, our clinical providers are doing this age group. We know that they are coming as well to many of our sites, and we know that it is so our school partnership is more a supplement for, out of convenience. Some parents might not be able to take their children, and this is, and again, we are working with schools that are willing, that they say we want to do this. They are providing most of those, and these are the numbers that the school provide. But as you suspected, we know that there are others, and I think we will start seeing those numbers as we are starting to plot that age group or do the age group.
Yeah, and I do read, I was reading an article yesterday about the percentages that the state of Michigan, how we're at, and it did seem that the under 16 age group was at a pretty high percentage already, even compared to the rest of us. So, that is encouraging. I did have one last question. So I know that demand for the vaccine has slowed a bit. What will happen if, let's just theoretically, no one else wants to get the vaccine as of today, and we're close up our clinics. This is the percentage where we're at. What would happen with COVID? Will it continue on? Will it mutate? Will it affect those who are already vaccinated if we never get to that 70%?
Right. So before I answer that question, I just wanted to show you again, this is the number that you are looking at for 12 and 15 in Wayne County. So the number is 87,000, and we just started a week ago. So this number is very encouraging, almost 15%. So yes, although we are, these numbers aren't only from the schools that we're visiting. This is from
and then even
vaccinated.
the 16 to 19
yes.
It's a good
So
percentage.
so to your second question, hopefully we will not encounter that at all. And I think we are doing very well, but it's going to be slower to get to that 70%. Of course, hypothetically speaking, if we do not get to that herd immunity, that means we will have that period where we coexist with the infection. There are those that are protected, but there will be still active transmission. I don't think we will go into higher spikes because there is some level of protection. But yes, the longer that virus is lingering on, the more potential it can have to reconstruct its DNA, to mutate, to find other ways to survive. And again, the mitigation that have been working very well in terms of protecting and stopping the spread, in addition to the vaccine, are our best policies, and this is what we keep pushing for.
Okay, great. Thank you. That's all I had. Thank you, Madam Chair. Oh, you're on mute, Madam Chair.
Thank you, Commissioner Dobb. Commissioner Killeen.
Thank you, Madam Chair. Good morning, good afternoon, Dr. Hammami.
Afternoon, sir.
No questions for you today, Doc. But I do want to comment, your stewardship and your leadership here. I just want to thank you for that in heading up the county response to this. I know it's been a yeoman's job, but also the last month and a half of data that you've brought to us, to me, says one thing and one thing only: vaccinations work. So thank you so much for the work you've done, Dr. Hammami, to this point, and the work yet to go. Thank you, Madam Chair.
Thank you, Commissioner Kleen. And thank you, Dr. Hammami, for all the work you are doing and for your report.
Thank you very much. My pleasure. And of course, it's the team of our Wayne County Public Health and all the support that we're getting across the board. We appreciate that.
All right, thank you again. All right, next item, Madam Clerk.
Item 2, communication from Carol Osterberry, Director, Health, Human and Veteran Services Department, Public Health Division, forwarding notification of an emergency procurement report for a contract with an option to renew with Garden City.
All right, this is receive and file. I believe the next 2 items, actually the next 10 items are receive and file. We'll take these together and then we'll have discussion on each of them. Is there a motion?
Move to receive and file, Anderson.
I'm sorry, commissioners, could I interject just real quick?
Sure.
Sure.
Chris Albrecht, policy analyst, commission staff. Items 2 through 5 are emergency procurement reports for receive and file, and then items 6 through 9 are first contact program contract amendments. And those are items that require commission approval.
Okay, so then we'll do 2 through 5. And Commissioner Anderson moved. Do we have support for 2 through 5? We will receive and file those.
I'll support.
Thank you.
Bob.
Thank you. All right, item number 2, we will move for discussion. Is there any questions from commissioners?
Yes, Madam Chair.
Yes, go right ahead, Commissioner Dunn.
Thank you. I noticed that Commission Council has a lot of concerns on these emergency procurement items. I just wanted to check in with her to see if she wanted to ask any of those or bring up any of those concerns in this committee. Is she here? I didn't even look.
Through the chair, I am here. Good afternoon, everyone. So Commissioner, you are correct. We do have an analysis for these particular emergency procurements. Some of the issues are issues that we've discussed and that you've seen in the past with regards to other emergency procurements. As far as there not being started end dates and terms for some of them, with regards to missing documentation. Again, many of the issues that we have discussed in the past with regards to other procurements, there are some unique ones I want to point out. So with regards to the one for Garden City, you'll notice that most of the concern is related to the term and the fact that they enter into an emergency procurement for 3 years, which again is something that we have discussed in the past regarding what's the appropriate time period for an emergency procurement, and whether or not 3 years is appropriate under the ordinance is something for this body to determine. So we did note that that particular item was 3 years. With